Aortic insufficiency, or aortic regurgitation, produces a high-pitched, early diastolic decrescendo murmur best heard at the left third intercostal space, along the left sternal border, with the patient leaning forward and holding their breath in expiration. It results from backflow of blood from the aorta into the left ventricle during diastole, leading to volume overload. You may also find abounding pulse and wide pulse pressure on physical exam. Recognizing this murmur is crucial, as chronic aortic regurgitation can lead to left ventricular dilation and heart failure if left untreated.